A client admitted to the psychiatric unit claims to be the Son of God and insists that he will not be kept away from his followers. The most likely explanation for the client's delusion is A religious experience, B a stressful event, Q pn6. Q client admitted to the psychiatric unit claims to be the Son of God and insists that he will not be kept away from his followers. The most likely explanation for the client's delusion is A religious experience, B a stressful event, C low self-esteem, D overwhelming anxiety. Rationale. Delusions of grandeur are associated with low self-esteem. Answer A is incorrect because conversion is expressed as sensory or motor deficits. Answers B and D can cause an increase in the client's delusions but do not explain their purpose, therefore, they are incorrect. Q. The client with a joint replacement is scheduled to receive Lovenox and oxyparin. Which lab value should be reported to the doctor? A PT of 20 seconds, B PTT of 300 seconds, C PRA time of 30 seconds, D INR 3. Rationale. A PTT of 300 is extremely prolonged and can indicate bleeding. Answers A, C, and D are incorrect because there is no need to report a PT of 20, a PRA time of 30 seconds, or an INR of 3 because these are within normal findings. Q. The nurse has given dietary instructions about food to be included in a low, purine diet. Which selection by the client with gout would indicate that teaching has been ineffective? A cabbage, B an apple, C peach cobbler, D spinach. Rationale. Answers A, B, and C are all foods included on a low, purine diet. Spinach should be avoided on a low, purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. Q. A client receiving hydrodiuryl, hydrochlorothiazide, is instructed to increase her dietary intake of potassium. The best snack for the client requiring increased potassium is A pear, B apple, C orange, D banana. Rationale. Answers A, B, and C are incorrect because they contain lower amounts of potassium. Note that the banana contains 450 mg K+, the orange contains 235 mg K+, the pear contains 208 mg K+, and the apple contains 165 mg K+. Q. A 9-year-old is admitted with suspected rheumatic fever. Which finding is suggestive of polymigratory arthritis? A irregular movements of the extremities and facial grimacing, B painless swelling over the extensor surfaces of the joints, C faint areas of red demarcation over the back and abdomen, D swelling, inflammation, and effusion of the joints. Rationale. The child with polymigratory arthritis will exhibit swollen, painful joints. Answer B is incorrect because it describes subcutaneous nodules. Answer C is incorrect because it describes erythema marginatum. Answer A is incorrect because it describes Syndrome's chorea.